and Clinic Manager, Tracy VanBuskirk. Good morning.
Morning.
Appropriate to be here on what is first day of fall weather.
Yes.
Yeah.
So all the fall illnesses are going to start pretty soon.
Yes.
Have they already started?
Yes. They have already started. We have seen definitely some COVID and strep also.
Yeah. I've seen in other parts of the country there's been some COVID-y outbreaks and things like that. How are we looking kind of right now in Jackson County?
So we have seen some COVID, but honestly at this point we're seeing a lot more strep than we haven't seen COVID. Not to say we haven't seen it, but
last year my daughter had strep without a sore throat, and I thought there's no way.
Yes.
And that's common.
Yeah, you can have some gastrointestinal symptoms, and that can present as strep. That is correct. Yes.
And with the various things you can come down with, people who self-diagnose, they could be off. They might not be right about what they think is wrong with them.
That is correct. There's some overlap of symptoms. So yeah, like strep, COVID, flu, all these upper respiratory symptoms, there's definitely some overlap. So it's not always what we think it is going on.
Are there some things that we can do to keep us healthy and protected from all of these awful things?
Yes, definitely. Hand washing is a huge thing we always talk about, but also vaccines. Flu vaccines are definitely available. Anybody above the age of 6 months, we want them to get the flu vaccine, especially those who are immunocompromised with any medical conditions and older than 65. Similarly, COVID booster vaccines are now available and also very, very much recommended.
Who's eligible for the COVID booster vaccine?
Well, actually, it's not technically considered a booster anymore.
New vaccine?
It is a new vaccine. It's very similar to flu, where they change if the prominent strains change. Then COVID is basically following what the flu vaccine does, which is whatever the newer strains are is going to be the new COVID vaccine. Fortunately, there's extremely limited supply of the COVID vaccine, so we really don't have the COVID vaccine. We're trying to get it, and it's kind of crazy, I know, but I think everyone's having trouble getting it. Yeah. So it is all of the previous COVID vaccines, which were fine, have been unauthorized because now we've included the new strain of COVID that's out. So that's essentially, we take the flu off the COVID vaccine was worked very well, but just like flu, it comes to a certain point where we take the previous flu vaccine out, and then we bring in the new flu vaccine. Same thing with COVID. We have the new COVID vaccine. So we're not considering it an actual booster vaccine. It's just going to, it looks like it's going to be just a yearly vaccine like we do for the flu. So we just can't get our hands on much. And
is it a supply issue, or what's the deal?
They haven't really told us why. We were able to order a tiny little bit, but it's not enough to even really
Why don't you call the CDC for everyone, Bart? You have a direct line.
That's an excellent idea.
Yeah, I think it is an excellent idea. But it's interesting because you do hear, hey, your people are being recommended to go maybe get this vaccine, but then we don't have it. So it's kind of crazy.
It's a marketing ploy.
It is a marketing ploy.
If you can't get it, you want it.
Yeah. There you go. So when you finally get it.
We definitely are getting calls. We definitely have a lot of interest
to
get it before this season, just like with the flu vaccine, which we have a ton of flu vaccine, a high dose, regular flu vaccine. We just don't have it to give out right now. We'd love to have it, but we just don't.
Yeah. Who's the high dose for?
65 and older.
Okay.
And like Travis Kelsey, when you do get the vaccine, you can get both at the same time.
Correct.
Yeah, you can actually could you get RSV, flu, and COVID at the same time?
You can get all three at the same time, yes.
Are we still seeing RSV?
We have not seen as much recently.
Well, that's good.
Don't want to say that anything is gone yet, but yes, and they will pop up probably after some time.
Are you guys accepting new patients at the center?
Always, yes, definitely. Call the center. We can get patients in pretty quickly, within a few days. To sometimes it takes a couple of weeks, but we definitely want new patients coming into the center. Yeah.
And you guys, you're never closed. You're open 7 days a week.
Yep, we are open 7 days. Monday to Friday we are open 9 to 9, and then Saturday and Sunday 9 to 6.
Do you have a walk-in side 7 days a week too?
Yeah, I'll have Tracy can answer.
Yes, we do. We do have the walk-in that is seven days a week, which is open till 9. Like they're open all day from
Yeah.
9 to 9, so they're open at the same time during the day that we are open upstairs. So in the event that our providers that see patients for their primary care, they can still be seen in walk-in. Even one of our patients that has a doctor that's a primary care, if it's something that can be seen in walk-in, that way they don't have to wait, they can be seen right away.
Now, once the vaccine for COVID is available, it's reformulated. So people might think, oh, well, I got a booster last May, I'm good for the rest of the year, but it's not protecting against the current strain that's
Correct.
circulating.
Yeah, that is correct, and that's why they've said that we don't use the previous strains anymore. They've completely been taken away. So we have the previous vaccines, that's why we have to go with the new vaccine that's available. And what we would want to say to our patients is if the vaccine is available anywhere, please get it.
Yeah.
When we have enough, of course we're going to be giving it, but wherever it's available, to please get the vaccine.
What do you do with all the old vaccines? Just throw them out?
Well, we didn't, with the COVID vaccine, we didn't have hardly
Oh,
any
yeah.
left at
Oh,
all.
really?
So we
Wow.
would just, there's a way to, we waste it
Yeah.
and report it. But there was hardly anything left.
Yeah.
It was very popular.
You guys have a couple of big construction projects going on now, and they've both started, right?
We've definitely started the construction in Blackstone, where we are going to move temporarily. Our walk-in is going to move in temporarily. And then we will soon be starting some renovation in the walk-in in our present building, and also some work for pharmacy. We're going to have a drive-through pharmacy soon, so that's the work that's going on.
Very good.
Yep.
It's all the rage.
You have that new machine in the pharmacy too, correct? The
Oh.
dispenser?
Yes,
Yeah.
the robot.
Yeah.
The
The
robot.
robot?
Yes.
Yeah.
The robot does a lot of work, helps our pharmacists with dispensing medications and getting the medications ready too. Yes, absolutely.
Well, we'll keep you informed when the folks at CFH do get the vaccine. We'll let you know about it, so stay tuned. Thanks for coming in today. Thanks for keeping all of us healthy and safe.
Thank you.
Thanks for
you.
having us.
Dr. Rose Johnson and Tracy VanBuskirk from the Center for Family Health. More of the morning show after this.